Hello, I'm Emilia Timotin, and in the following motion picture, I'll present the basic of brachytherapy and some of its applications. We call it brachytherapy or internal radiotherapy or Curie therapy. Brachytherapy is an advanced radiation therapy given at a short distance, very localized to the target, and very precise in placement of radiation sources directly at the tumor site. A bit of history. 1896, Henry Becquerel accidentally discovered radioactivity, emission of radiation by an element, but Marie Curie actually coined the term. 1901, Pierre Curie, her husband, suggested that radioactivity could be used to treat cancer, and the radiation source inserted into the tumor can decrease its size. Between 1903 and 1950, a number of other doctors pioneered actually the application of brachytherapy to treat different types of cancers. Following these early experiments, interest in brachytherapy grew. Here we are in 2005, when an expansion was done at the Cancer Center in Hamilton and made it possible to design its first high-dose rate brachytherapy suite. Allow me to explain the element that emits the radiation. It is iridium-192, and it's a radioactive source in a tiny seed form, the size of a grain of rice. It is a live source, which means the strength decreases in time. Iridium has a high specific radioactivity, allowing to provide a very high dose rate, rapid radiation dose delivery, or simple HDR. Being small and having this high radioactivity, iridium has proven to be an often used source for HDR brachytherapy applications. The source, the iridium, is usually sealed within a protective capsule and placed into the head of the brachytherapy machine, shown in the next picture. The brachytherapy procedure is conducted in a shielded room, but the delivery of the radiation is done automatically by the computer located in a connected room. This is called remote afterloading technique. The applicator is a thin plastic tube called catheter. One end of the catheter is placed close to the tumor under fluoroscopy guidance, and the other end is connected to the brachytherapy machine. During the treatment, the afterloader machine passes the miniaturized source through the catheter, which directs to the tumor sites. The duration and positioning of the seed can be used to control the radiation dose in different regions of the tumor. If more than one catheter is used, they are automatically loaded one at a time with the radiation source. Once treatment time is finished, the seed returns into the afterloader and the catheter is removed, leaving no radioactive seeds in the body. While the brachytherapy unit is not in use, the source is relocated into a safe and poses no risk of radiation exposure. The fact that health professionals can use the machine from a different room makes radiation exposure to them very minimal. Basically, this type of radiation can be applicable for localized tumors in any part of the body. The source of radiation is placed strategically either close to or along the side of the tumor, and then it's called intraluminal, used for esophagus, lung, bile duct, colon, and rectum. Can be placed externally on the surface, and it's surface brachytherapy used for skin, directly into the tumor, and then it's called interstitial, and it's used for prostate or breast or anus, or inside a body cavity, and then it's called intracavitary treatment, and it's used mostly for cervix and endometrium. This procedure is performed usually on an outpatient basis. That means the patients, after the treatment, they are able to go home. Lung brachytherapy is applied almost any time a tumor is detected in an airway on bronchoscopy. The procedure starts with an examination of entire bronchial tree. Once the tumor is identified, the bronchoscope is used to deliver the catheter into the position at the site of the bronchial tumor. The placement of the catheter is confirmed by fluoroscopic images. The scope is then removed, leaving the catheter in place. Single or multiple catheters may be used for the treatment. The radiation oncologist digitizes the treatment volume, which may acquire different shapes to encompass the entire extent of the tumor. Once the treatment plan and dose is established, the treatment can be commenced. So when do we apply the brachytherapy for lung? We apply it to open an almost blocked lung airway, to stop bleeding, to treat again a previously irradiated lung cancer, or to treat a very early lung cancer. To summarize, brachytherapy is a method of radiation therapy using a relatively intense source of radiation to deliver a high dose at a short distance to the target. The dose is delivered in a small time frame through temporarily placed catheters. The radiation affects a very localized area just around the source, and the dose decreases rapidly in the adjacent healthy tissue. Here we are at the end of our presentation. The advantages of HDR brachytherapy are short treatment times, ability to provide outpatient procedures, less patient discomfort, reduced applicator movements during treatment, avoid delivery radiation to the surrounding healthy tissues, possibility of treating larger number of patients, and not last, avoidance of radiation exposure to the healthcare professional.